I truly believe that no one person can change a culture, but that a dedicated group of people with a shared strategic vision, well, together we can build a culture. And I think that's what today is all about. To talk about it, to learn about it, to vision it together. How do we do this? We do this by sharing our strategic visions and the goals of our health system, by developing a better understanding of how, through philanthropy, we can help to facilitate and achieve those goals. And this afternoon, to share best practices. And we're doing that to ultimately add strategies and tools to each of our individual toolboxes. This will allow us together to begin the building process. It is the relationships that we have with each other and the members of our community that are our foundation and our building blocks. You know, all year long we plan and we attend special events, all to benefit our hospitals and our long-term care facilities. But it's not about the events. And I think that's what today is about, because it's about the relationships. It's about the relationships that we build at those events and how we share the experiences at those events with our friends, with our neighbors, and with our colleagues. It's that sharing in those experiences that build and nurture the relationships that will ultimately benefit our hospital and our community.
Relationships, as I'm sure we all know, are extremely important in our personal life, our professional life, but also in our philanthropic role. There were studies done, or research done, that showed what made a good relationship. The number one attribute for a good relationship is trust. The number two is respect. And the number three is reputation. So the trust and respect come from you all in your interaction with your friends, associates, people that you work with or socialize with. The reputation comes from all the organizations that we all represent. So really, we can see here how integral you all and the people on our boards are for building positive, productive relationships. The bottom line is that people give to people who can articulate their vision with passion and represent organizations that the giver respects.
Giving money is a very satisfying experience. And the people who do it are grateful to you for having given them the opportunity. Special events are a great way to introduce people to your institution. They're good public relations usually and so on. But I want to challenge you to look at your events to determine if they're meeting some of these criteria. We want them to leave that event with a greater feeling for the hospital, meaning they like the hospital better than when they came. So how much time are you spending on the hospital at your events and featuring the hospital at your events and the kind of quality, excellent care that people get there? We want to make sure that the event, and think about this, look at each of the events you do, and say to yourself, is this going to deepen the relationship?